Hello everyone, this is Justin Vaughn with MiraMed Global Services. Today's article, the 2022 IPPS Proposed Rule, Part 3. Let's begin. Today's article will conclude our look at the massive 2022 IPPS Proposed Rule, or PR. So far, we've summarized how the PR treats topics such as payment rates, quality measures, negotiated payment disclosure, residency programs, and efforts to reduce hospital readmissions. Based on a summary of the PR released by the Centers for Medicare and Medicaid Services, or CMS, we will now provide some of the remaining highlights of the government's proposed changes impacting hospitals in FY 2022. This first section is entitled Promoting Interoperability Program. In 2011, CMS established the Medicare and Medicaid EHR incentive programs, currently called Promoting Interoperability, to encourage meaningful use of certified EHR technology, or CERT. In the 2022 PR, CMS recommends the following changes to the Medicare Promoting Interoperability program. First, increase the EHR reporting period to a minimum of any continuous 180-day period for new and returning eligible hospitals and CAHs for CY 2024. Second, increase the available bonus for the electronic prescribing objectives query of PDMP measure from 5 points to 10 points. Third, establish a data availability requirement to provide patients electronic access to their health information measure. Fourth, add a new health information exchange bi-directional exchange measure as a yes/no attestation beginning in CY 2022. Fifth, require reporting yes on 4 of the existing public health and clinical data exchange objective measures. Sixth, attest to having completed an annual assessment of all 9 guides in the Safer Guides measure under the Protect Patient Health Information Objective. Seventh, remove attestation statements 2 and 3 from the Promoting Interoperability Program's Prevention of Information Blocking attestation requirement. And finally, increase the minimum required score for the objectives and measures from 50 points to 60 points out of 100 points to be considered a meaningful EHR user. This next section is entitled Value-Based Purchasing Program. The Hospital Value-Based Purchasing, or VBP program, is a budget-neutral program funded by reducing participating hospitals' base operation DRG payments each fiscal year by 2.0% and redistributing the entire amount back to the hospitals as value-based incentive payments. The PR recommends several measure suppressions for the FY 2022 program year. As a result of these suppressions, CMS believes that calculating a total performance score, or TPS, for hospitals using only data from the remaining measures would result in an unfair national comparison. Accordingly, the agency is also proposing to refrain from calculating a TPS for any hospital based on one domain and to instead award to all hospitals a value-based payment amount for each discharge that is equal to the amount withheld. This next section is Medicaid Enrollment of Medicare Providers. By way of background, the Medicare savings programs and certain Medicaid statutes require states to pay the Medicare cost sharing for dually eligible individuals. However, through what is commonly referred to as lesser of policies, states are allowed to pay less than the full Medicare cost sharing, or in certain circumstances, make no payment at all. If states pay less than such cost sharing amounts, certain Medicare providers may submit these unpaid cost sharing amounts to Medicare for payment as reimbursement for, quote, bad debt, end quote. In order to claim Medicare bad debt, a provider must show it has tried to obtain payment for the debt. Under the proposed rule, CMS would require Medicaid provider enrollment systems to allow valid enrollments from Medicare providers serving certain Medicare-Medicaid dually eligible individuals, even if a provider or supplier is a type not recognized as eligible to enroll in the state Medicaid program. This recommended change is meant to lessen appeal and litigation costs. This next section, Medicare Shared Savings Program. The PR recommends changes to policies for the Shared Savings Program that will allow eligible accountable care organizations, or ACOs, participating in the basic TRACS glide path option to elect to forego automatic advancement along the glide path's increasing levels of risk and potential reward for performance year, or PY 2022. Under this proposal, an eligible ACO may elect to remain in the same level of the basic TRACS glide path in which it participated in PY 2021. For PY 2023, an ACO that elects this advancement deferral option would be automatically advanced to the level of the basic TRACS glide path in which it would have participated during PY 2023, but only if it had advanced automatically to the required level for PY 2022, unless the ACO elects to advance more quickly before the start of PY 2023. Easy for you to say. Next section, rural designation. Along with the 2022 IPPS Proposed Rule, CMS is issuing an interim final rule, or IFR, to amend its current regulations at CFR 412.230 to allow hospitals with a rural redesignation to reclassify through the Medicare Geographic Classification Review Board using the rural reclassified area as the geographic area in which the hospital is located. These regulatory changes align CMS policy with the decision in the court case Bates County Memorial Hospital versus Azar, found at 464 Fed Sup, and that's in the DC jurisdiction. For the full CMS summary of the 2022 IPPS Proposed Rule, you can go to a website and type in 2022 Medicare Hospital Inpatient Prospective Payment System, and it should pull up the proposed rule. It's important to remember that these revisions are only proposals and are subject, therefore, to change. We will update you once the final rule for FY 2022 is published. Remember also that you can reach out to us at info@miramedgs.com if you have questions for us. Thank you.